good morning, everyone. My name is Emily Rudmann. I'm a third-year medical student here on behalf of the Student Interest Group in Neurology at New York Medical College, and I am joined today by Dr. Rachel Hirschberger, a pediatric epileptologist and general pediatric neurologist. Dr. Hirschberger, thank you so much for joining us.
Thank you for having me.
So I wanted to start by asking you if you could tell us a little bit about yourself and your journey to becoming a physician.
Yeah, absolutely. I grew up on Long Island. I have always been interested in science. My mom is a genetic counselor. And so from as early as I can remember, she was talking about DNA and patients and my like a book report in first grade. She recommended that I do it on it was a special persons report on somebody named Barbara McClintock, who was instrumental in the Punnett Square. So from very early, I was kind of inundated with women in medicine. Um, and then when I went to college, I was drawn to all things neuroscience and also health policy. And so, kind of in my college, post-college, and into medicine time, I was debating between doing health policy and medicine. I worked at Mass General doing Huntington's disease research after college, and this was really my first time working with patients, and I loved it. Knew I wanted to work one-on-one. I looked for med schools that had an MD MPH program, so I ended up doing an MD MPH at BU. Um, and I'm still very interested in health policy and kind of thinking more broadly about health. Um, and I've sort of translated that over time into more of the education and quality improvement spheres in the hospital.
Wow, that's incredible. Thank you so much for sharing that whole journey. And it's so interesting to know kind of the steps you made along the way and then how you're using those previous experiences in your current practice. I'd love to hear more about kind of your QI interests and everything that you're currently working on, but I just wanted to quickly go back and ask if you were at any point deciding between any other specialties, and how did you end up selecting neurology and pediatric neurology specifically?
Yeah, I was never considering anything outside of neurology. So my debate was adult or child neurology. Just from college, I took all the neuroscience classes that I could. I just think that the brain is fascinating, and I think that's another question of how you chose that. But um, I think the science really drew me in of neuroscience, and then as I got to medical, I did research, like I said, in Huntington's disease and kind of seeing the neurology really very directly in action and learning about research trials. Um, and then into medical school, neurology just always drew me in, the complexity of the cases, the puzzle of it. For pediatrics, as soon as I did my pediatrics rotation, I knew that I wanted to do pediatric neurology. So, I loved my adult neurology rotation. And as I did that, I thought I would do adult neurology. But then when I worked with kids, it just made me happy. It was a very basic feeling of being in a children's hospital, being around pediatricians and being around kids. And then I also really love the pathology and the disorders that you see in pediatric neurology.
That's awesome. I'm curious to know actually, my next question kind of leads in nicely to what we were just talking about. What conditions do you now treat as a pediatric epileptologist and then general?
So mostly seizures, because I am in epilepsy and pediatric neurology on the inpatient side, there's a ton of seizures that come into the hospital. So the way I have both inpatient and outpatient exposure, or inpatient and outpatient practice. Outpatient, a lot of question of seizures come in because I am epilepsy, but then general neurology I like also. So we talk about migraines or maybe low tone, gross motor delays. On the inpatient side, which I have loved to continue doing, I really like demyelination cases or even pediatric stroke, which is rare, but just fascinating. So I think the bulk of my practice is seizures, and then I really like the breadth of pathology that we see in pediatrics.
So it sounds like the most common condition that you see and treat is pediatric epilepsy.
Yeah.
Obviously, given your specialty in epilepsy. So I'm wondering what is kind of the balance that you have between your outpatient specialty
Mhm.
practice and then inpatient time? Like, how does that work for you in terms of your breakdown?
Yeah. I have experimented with this in my almost 3 years of being an attending so far. So the first year, I had about 8 weeks inpatient, and then I wanted more, and the needs of the department were such that I actually did every other week inpatient. Um, that was it almost served as a neurohospitalist fellowship for me, and I'm really glad I did it. I became so much more comfortable managing as an attending all the inpatient conditions. Work-life balance wise, it was a little much, and so then I scaled back again. So now I'm really happy with my breakdown. I do a week a month inpatient, and then the rest of my practice clinically is outpatient.
That's great. I'm glad to hear that you were able to kind of find that balance that works for you. Um, just as a kind of follow-up question from that, do you find that you have like any, or is how frequently do you have like continuity between your inpatients and
Yeah,
outpatients that you see?
very often. So I really like that kind of weaving of inpatient and outpatient. So um, the new presentations are fascinating. And so I think I get that and that diagnostic mystery on the inpatient side. Absolutely on the outpatient, but the workup is slower, right? But the patients by definition are not as acute. And so the kind of adrenaline rush and the immediate problem solving is on the inpatient side. But I also love the continuity of care and kind of seeing how and learning how my patients evolve over time. And so I'm able to plug the patients that I see often from the inpatient side to outpatient, not always because schedules are busy and people can't always, make appointments that you have, but a lot of times I really try, especially the neonates that I see on the inpatient side. I see a fair amount of neonatal seizures, hypoxic ischemic injury of the newborn, and just being able to form that relationship with the families on the inpatient side, and then very long-term outpatient is really special.
That's great to hear. So it sounds like you have these kind of two pieces to your practice, the inpatient and
Mhm.
outpatient. I'm wondering what is like a typical week for you on kind of both of those, if you don't mind going
Yeah,
over that.
yeah, absolutely. Um, I'll talk about there are other facets. I think my department has supported me exploring a lot of different interests, which is one of the reasons I wanted to be here. On the not clinical side, I just am the new program director for a new Child Neurology Residency Program, which was approved by the ACGME in 2025, and we just matched our first cohort. We're so excited, and they'll start as pediatrics residents. And so uh, a portion of my time is dedicated to developing the pediatric neurology residency program and then running that. So mostly that's done on my outpatient week, so I have some time carved out there. I have some time dedicated to the pediatric residency program here as well. So I do work just on the general pediatric neurology side. I also, as outpatient, have time where I'm reading the outpatient EEGs, which I can do from either in the office or remotely. Um, so work-life balance wise, which I know we'll talk about later, it's really worked well for me to have all these different pieces. Um, I, in the beginning, when I first started, I thought I would do a little bit more quality improvement work, and I have been doing some, but um, you eventually have to narrow down, and I have a lot of interest, and the opportunity presented itself to do the residency program, and I really wanted to be all in there. So for the moment, I'm kind of putting my efforts into developing the residency program, but I would like to kind of more formally get back into some quality improvement projects later on. So to answer your question on the outpatient side, I have some days where I'm going to clinic, some days I'm doing telehealth, some days I'm working on the residency program from the hospital. It's kind of all over. Remains really interesting and dynamic. And then on the inpatient side, it's I read EEGs as well as seeing patients all over the hospital. So currently, we are structured that there's one pediatric neurology attending on at a given time with some additional support from epilepsy readers to kind of help with more surgical cases. I think we are hoping that we're going to divide into two services and have an epilepsy monitoring unit and a general neurology service. But right now we're doing a little bit of everything. And so I start my morning reading EEGs. I round with the inpatient team with the residents, the pediatric residents. We often have other residents on our neurology team, so adult neurology residents, for example. And then we go to the pediatric ICU, see patients there, do as a consult, the neonatal ICU, sometimes the emergency room, and then sometimes consults on the pediatric service. So again, very active and all over the hospital. Um, so that's my general week.
Wow, it definitely sounds like you have a lot of different, even within the hospital kind of practice settings in the sense that you're
Yes.
seeing these different, you're going to multiple ICUs, you're going to the
Yeah.
ED, the floors. And it does sound like you are, and I think this is true often of a lot of different services in the hospital, but you're kind of working with a lot of different, like a lot of interprofessional kind of
Yes.
interweaving, which I think sounds really exciting and interesting, especially with you're working with general pediatric residents. Soon you'll be working with pediatric neurology residents.
Mhm.
And I'm wondering, to what degree do you collaborate with the adult neurologists in the hospital as
Mhm.
well?
More and more now. So, Dr. Milligan was actually my attending when I was a PGY3 resident. She was at Brigham at the time. So she was my adult neurology resident. So she is one of the reasons I was drawn here. Um, and with her mentorship and guidance, who's been, instrumental in developing our residency program, I think we are working on bringing the adult and neurology together. And I think the residents help lead the way in that. So the adult neurology residents rotate on our services. We really appreciate their input, especially on, the adolescent patients, on stroke patients, on demyelinating cases. We see a lot of overlapping pathology. Um, and our residents will be embedded largely within their adult neurology curriculum and will share a curriculum. So I think that the residency program will tie it together even more as that builds more and more. Um, on the attending side, especially cases like the pediatric stroke cases, the adult neurologists are very willing to kind of talk through the cases. We don't have there are very few in the country dedicated pediatric stroke specialists. Um, so many hospitals will kind of talk through cases with their adult stroke colleagues. Additionally, pediatric autoimmune disorders, while we see it very frequently, we don't have somebody like dedicated pediatric neuroimmunologist. So kind of some long-term management. When patients are 16 or older, they can be seen in the adult multiple sclerosis clinic. For the most part, I think it's 16. It might be closer to 18. Um, and I will sometimes reach out to the neuroimmunologist for their expertise as well for cases that could be seen by either pediatric or adult neurology. And I think we're moving closer to kind of attending each other's grand rounds and all of this to say it's becoming more and more integrated, and I'm really looking forward to that.
Yeah, that sounds like a really wonderful and kind of fruitful longitudinal collaboration,
Yeah.
especially given that children do become adults. So it's like it's obviously clinically important as well, in terms of continuity of care and transitioning care and that type of thing. Um, going back to your kind of weekly schedule,
Sure.
on a day-to-day, how many hours are you working in your different inpatient and outpatient roles, and how does that compare to residency?
Nothing compares to residency. So everything is going to be less than residency. Um, it varies so much. And so on the inpatient side, I would say at least 9 hours a day, but if there are acute cases, it could easily go longer. Outpatient is a little more set, right? Because you have a regular schedule. And so outpatient is closer to 9 hours. But then on days where I'm doing education, it could be 8 or, 7. It varies based on the week in general. Um, I would say most physicians don't work a 40-hour work week, closer to 50 hours, but I think that's probably about what I'm working. We do take call as well, so that doesn't include call. And so the way our division works is um, a, a couple of, about 3 times a month on the weeknight, I'll take call, but it's home call. So I'll be fielding questions from home. And I'm not including that in the hours that I just said. And then we share weekends as well. And so kind of we're growing as a division, and as we grow, it's fewer weekends, but maybe one in between 6 and 8 weekends we're working. I mean, in residency, you have a 80-hour work week. I would say that I didn't always, in pediatric neurology, we didn't always get to 80 hours. It would often be less than 80 hours. You're not going, I didn't go over that. But you work about every other weekend in residency. And so I still am close enough to residency to feel like this is amazing.
That's great. Yeah, it's good to have, have that light at the end of the tunnel that you're going to have more control over your timing that you're spending in work and home. And so that leads to my next question, work-life balance. Do you feel that one or the other, like inpatient versus outpatient, is able to give you that more, or how do you feel your work-life balance is today?
Yeah, I'm happy with my work-life balance right now. I will say it is a constant evolution, and it's not perfect. It's really hard to achieve, and I think that a lot of and I'm a mom. I have 2 little kids, and I'll just speak for moms in medicine because I have a lot of friends who are moms in medicine. It's really hard. It's hard to feel like you're not 100% in either area because that would be 200%. So something has to give. Um, I feel like I am comfortable with and I'm happy with how I've structured my time right now. Um, Doing the every other week inpatient, while it was much lighter on the other weeks, it was just too unpredictable for picking up for daycare, for example. And so the predictability of the outpatient makes it a lot easier for having little kids for me. But I love the inpatient. And so for myself and my career, I definitely want some of that. And so it's a balance. It's kind of what feeds you. Um, and that for me is both my professional life and my family. Um, I've In residency, I had 2 program directors, transitioned in the middle, and my first program director had us write down so child neurology residency is 5 years, and then I did a 6-year in epilepsy fellowship. At year 3, when I first entered my neurology time after my pediatrics time, they had me write down like, where do you see yourself exactly in 5 years and in 10 years? And I've really used this as a guiding light for myself. I do not have a house on a lake like I thought I might have at 5 years. I'm like very far from that. But otherwise, I'm happy with where I am at the 5-year mark and have used that as a guiding light for myself. I can talk a lot more about work-life balance. I think it's really important to think through, but you really don't know how it's going to feel until you're in the various stages. So you can talk about and think about residency, but until you're living it, it's hard to imagine being in the hospital overnight and on 24-hour shifts. And then until I had kids, it was hard to imagine what that would be like too, and trying to a balance. And so it's a constant evolution.
Thank you so much for sharing all of that. Um, Another work-life balance adjacent question, do you go on vacation and how often?
Yes. Yes, I go on vacation. I mean, it's pretty a standard. I think you get like a little over 4 weeks technically vacation time, but other holiday time is thrown in there, and time for conferences, which is not vacation, but it's not like clinical active. So yes, we go on. Definitely, I am a big fan of turning off and not responding and asking my colleagues to cover when I'm on vacation. And so we took the kids camping in Colorado last summer, which was an experience, but that's definitely going on vacation.
That's great to hear. I'm wondering, do you have any advice for aspiring neurologists and then aspiring pediatric neurologists as well, if there's anything that you'd like to add specific to peds?
Yeah, so let's see. I think just for anybody, any medical students, I would say really as you're going through med school and into residency, pursuing what you're interested in, not what you feel like you should be doing for the next step. There's always a next step. The next step for me is thinking about promotion from assistant professor to associate professor, right? There is always that next step. And so you have to be happy with what you're doing along the way. At the end of medical school, I got involved in a research project that was, a really fantastic learning experience, but I think that it wasn't really my passion doing research. And I spent a lot of time on that particular project that I could have spent on quality improvement or just other things to learn about. And I'm really like grateful for what I learned during that. But I think had I continued to do research in certain topics I was not as interested in, it would have gotten frustrating. And I see that in people that I've mentored, like just continuing to do what you think you should be doing instead of what you're really interested in. Because now, having reviewed applications for residency, I'm just one person, but really, I just want to see that you're doing what you're passionate about and that comes through, rather than just like checking a box.
That's great advice. I think that is similar to the question of, how you're spending your time is, I think, an ongoing thing that everybody sort of grapples with. And it
Yeah.
is difficult to kind of select or to pare back what is, the thing that is going to fulfill you the most, that you're the most passionate about versus that next step, which, as you mentioned, is always there. So that's really good advice, I think, for students, interested in any specialty. Um, and then again, specific to neurology, what are the biggest challenges that you see facing neurologists today?
Again, not only specific to neurology, but time in medicine has gotten really hard. And um, I think pediatric neurology people so far have recognized you need a fair amount of time to do a good outpatient exam, but there's always pressure to do more in less time in medicine in general. So that's the biggest challenge, and I think AI can both help with that, but I worry in some ways that it'll pick off the easy parts of your job and leave you with the complex things. So, for example, I enjoy, not enjoy, but like I don't mind sitting down and writing my notes because it's when I synthesize information and it's a moment to like drink my coffee and just like recollect myself before I am forward facing and seeing the next person. I think if AI only wrote my notes and queued up my prescriptions and I was just like on to the next, I think that would add an intensity to my day that I imagine is going to be there within the next 5 years, right? And so um, I think I think we all need to be careful about if AI lets you do more in less time, you're going to be asked to do more. So, and that adds it just adds pressure. So I'm a little concerned about that piece. I'm not worried about AI reading EEGs, and that comes up a fair amount. I think that'll happen, and I think that'll be good, but I do believe that there will be, I imagine that there's going to be an epileptologist both involved in that process and overseeing some cases. And I think there's an endless uh, like supply of EEGs in the world almost to be read. And so I think that would advance access to areas that have less access in the community. And so I don't think that would be a problem per se.
Well, thank you so much. That answer actually, that kind of answered my next question as well, which was how you think the field is going to change over the next 10 to 20 years. I think everybody is sort of pondering how AI is going
Yeah.
to transform whatever field that they're in. But I think those are really great reflections, and thank you for sharing that. So I want to ask you one more question. which is our fun question. What is your favorite part of the brain or the central nervous system? If you want to pick something peripheral, that's totally fine.
Um, when I read that, when I was thinking about that question, it's actually an EEG feature. That's my favorite. There are these little sleep spindles that come up. So you see sleep spindles in stage 2 sleep for both kids and adults. But the
Mhm.
kids' sleep spindles are particularly adorable. And before age 2, they are asynchronous. They happen on one side of the brain and the other, and they're just really beautiful. And so when I was in fellowship, like we had a group of people that would text, like, "Oh, like I found a cute one," and we would send each other pictures of it. So sleep spindles are my personal favorite.
Great answer. Well, thank you so much, Dr. Hirschberger, for sharing all of this really wonderful information about your career and your interests and how you're spending your time now. Before I close the interview, is there any like final reflection you'd like to share, or I guess any more advice for aspiring neurologists?
I think I was coming around this theme in a lot of questions, but just that your career is an evolution. And I have kind of taken a little bit of a winding path so far between policy and medicine and education. And just being open to saying yes to those different pieces and kind of fitting it together. And I definitely don't have all the answers. I'm still in the beginning of my career, but just kind of being open to that changing. I think it's what keeps a career exciting for me, at least.
That's wonderful. Thank you again so much.
Yeah, you're welcome. Nice to meet you.
Nice to meet you as well. Okay, I will close out our interview.